Hey everyone, and welcome today. My name is Carly Kleinditz. I'm a nursing student at Methodist University. Today we're going to talk about caring for the caregiver. You noticed today when we came in we had you do some deep breathing exercises. This was to get you guys all relaxed. I know you're under a lot of stress and you don't get the chance to relax very often, so that's why we did that. Hope you're all feeling good today. You're ready to learn. We also had you write down some objectives and goals for today's presentation, what you wanted to get out of it, and it's really important that you guys get something out of this today and that you feel good when you leave here. So I'm going to read some of the themes that I noticed in your note cards I passed out this morning. You wanted to learn to manage stress and time management skills, learn about managing your feelings of depression and resentment, and you just want to be happy again, which is a good thing to want. So my goal for you today, I want everyone to leave and feel empowered to problem solve and to time manage, and I want you to feel empowered to put your own physical and mental health as your priority. So that's what I want out of this today. First, we're going to go over some health hazards to caregiving. As you guys all know, caregiving is a very stressful and hard job, and not a lot of people understand. So the research says that caregivers are at risk for fatigue and sleep disturbances, lower immune system functioning, which just means you get sicker more often and you stay sicker longer, altered response to vaccinations like a flu shot, slower wound healing, increased insulin and blood pressure levels, higher risk for heart disease, and these declines in caregiver health have been associated with caregivers feeling burdened, who perceive themselves as burdened. In conjunction with that, caregiver burden and strain, they've been related to increased health risk behaviors. Two examples of this are smoking and increased prescription drug abuse. Alright, so today we're going to talk about two different caregiver acronyms. First is COPE and the caregiver stop sign. First we're going to talk about COPE. COPE is creativity, optimism, planning, and expert information. Now with creativity, it's creativity in generating solutions to your problems and problem solving. So an example of this would be, say you had to make some thank you cards or you had to send out some kind of invitation and you needed some time to do your craft. Get your loved one involved in this craft. Maybe they can help you with the cards, or maybe they can do their own little card or their own little craft. Another example of this would be, say you had to take your dog to the vet or take someone to an appointment, and next door to your doctor's office there was a park or an outdoor area. You and your loved one, whoever you had to take care of, could get some outdoors time, which would be healthy for the both of you. Optimism. Optimism is essential for emotional regulation. That's something that we're going to talk about a little later, but just keep it in mind. Planning. This is very important. Planning is important to follow an orderly approach to solve your problems. Use to-do lists and prioritize these to-do lists. If you can, I don't know if you've heard the phrase, kill two birds with one stone, group together your tasks, get more than one thing done at once. An example of this would be, say your loved one had some sort of physical therapy or occupational therapy they had to do for the day. They needed to practice washing dishes. You could have them wash the dishes, you're getting your chore done, and your loved one's getting their therapy done for the day. Finally, expert information. This is really important, you guys. I know medical professionals can seem really intimidating, but they're great resources. They do this for a living. I know you might not have signed up for this, but we did. So we've taken a lot of time to try and perfect it and get as best as we can be at it. Your experts or your medical professionals, there are professionals at managing care. A lot of nurses come in and have a really high patient load and have to prioritize their interventions for the day, and I know they could have some tricks to help you get things done quicker and more efficiently. Pay attention to your preventative measures. If you can prevent a fall or prevent an infection, that is going to save you work in the end. Oh, now we're going to talk about the caregiver stop sign. We're on the same slide here. The caregiver stop sign is seek out opportunities for support, take time for things you enjoy, opt for help whenever you can, and prioritize your needs. Your support can be support groups, family, your healthcare team, like I said. For the timeouts, an example of this would be, say you really wanted to go to a concert and you're discouraged because you can't go because you have to take care of your loved one that night. Well, take a minute, sit down and listen to the CD, watch some YouTube videos, use your technology, anything that you can do to take a time out and relax and make the best of what you got. Opt for help whenever you can. Don't be ashamed. It's here. We're presenting it to you today, and just you being here is showing that you're seeking help. And then to prioritize your needs, we talked about earlier in the planning. This, I think, if you take anything from here today, this slide is the most important. Be proactive, not reactive. What this means basically is taking your problems head on, and not even problems, maybe tasks, duties, getting things done ahead of time and at the right time, and not be reactive to a problem that arises because you didn't get something done. So be proactive, not reactive. I want you to do this in your own healthcare as well as your loved one's healthcare. So don't let yourself get to the point where you need to go get all this help when if you just would have watched what you ate or exercised or slept a little longer, you'd be okay in the end. This is going to reduce further complications. So finally, we have 8 coping strategies we're going to talk about to ensure your health. This has a lot to do with the optimism. This is all about you. So we're going to go through these one at a time and explain a little bit more about them. So number 1, take time outs. Like I said about the concert thing. Do something that's going to be relaxing and productive for your health. Anytime you get a time out or you need or you feel stressed, take your time out, go on a walk, just go sit down, do whatever you need to do. 2, accept yourself. Know that you're human and that you have needs to fulfill. You have social needs, you have physical needs, and you have psychological needs. It is normal to have emotions, even negative emotions, especially going through what you guys are going through. It's really important not to deny these negative emotions and to not hide them deep inside, because that's just going to make them grow and become worse and become more of a problem. So number 3, express these feelings, and this all has a lot to do with your emotions and your feelings that you're experiencing right now. Be honest with yourself, get them off your chest, whether you need to write them down or say them out loud. Talk to your dog, whatever you have to do. We're all here to listen. Your feelings might not seem rational, but they're there and that's what they are. So whether they're rational or not, you need to express them. You need to find your own way to express them in an unharmful way. After expressing these feelings, it's not over. You need to find the root and you need to get to the cause and you need to try and correct that so they can stop occurring, especially if they're negative. 4 is coping with these emotions. I kind of already went into that. And we have in your handouts different emotions that are really common among caregivers. I'm not going to talk about all of them today, but one that I think can get really dangerous in caregiver world is anger. You need to learn how to express this anger appropriately. Now, a lot of people I think would say if you feel violent with your anger that you shouldn't express it violently. I'm going to tell you no. If that's what you need to do, then you have to find a way to take your violence and, like I said earlier, do it in an unharmful way. You know, take up boxing. I know it sounds silly, but take up a sport. Let it out. If it's going to be violent and physical, let it out somewhere that it's okay to be violent and physical. Go outside and throw rocks into a lake or a pond, whatever you need to do. Yell into a pillow. Ideally, if you could channel your anger into something productive, this might not be for everyone, but if you can channel your anger into doing chores or cleaning or something like that, obviously you're going to be killing 2 birds with 1 stone, like I said earlier. Number 5, quality time. Know that you're not alone. I mean, just look in the room that you're not alone. And if you feel alone, then come to me and I'll help you find a support group. I'll be your support group. There's plenty of resources around. Don't distance yourself from your family. It's really not healthy and it's not safe mentally for you. They're here too, and they're going through it in their own way. So talk about it with your family and friends and those who are around your loved one and see what they're thinking. Avoid withdrawal. I mean, just have social interaction, even if it means just smiling at someone in the grocery store. If you can talk to someone that day, then that keeps you connected with the world. Next is focus on the positives, which is pretty self-explanatory, and it's something I think that's really hard, even though it's so simple. Find something positive every day, even if it's small, as many positive things every day, but even if it's just one, then focus on that. Focus on the positives of that day. Number 7 is make personal declarations. I like to call these power statements, and these can be goals. They can be, what you stand for, and remind yourself every day what you stand for in your goals, and, even if it's something encouraging really about how awesome you are, something good you've done, just something that makes you feel powerful. And finally, number 8 is relax. I know this is hard, and you might think that's even funny that I mention it, but any small amount of time you can find to relax, whether it's 30 seconds, you can sit on the couch, an hour, 10 minutes. it'll all add up. If you can sit down for 30 seconds every hour, then you've relaxed a little bit and you might not feel as stressed. So in conclusion, some final thoughts are things I really want you to take away from this and things that I think are the most important part of today's presentation. So incorporate your loved one into your daily activities as much as possible, like I've touched on, with your planning and with trying to integrate them and trying to kill two birds with one stone. Make memories, because that's really what's going to make this all worth it. You have a really special bond with whoever you're taking care of, and I don't think anyone else really understands besides who's there. By being healthy and meeting basic physical needs like sleeping and eating and exercising, you'll be able to move on to meeting your social needs and your psychological needs. And after that, you'll be able to meet even higher levels of needs. And you can be the best person and caregiver that you can potentially be if you can meet all these needs and you can build your way up. Remember your cope and your stop. And like I said earlier about the support systems, we've added some different support systems and different resources throughout the community and throughout North Carolina in your handout. And if you have any questions about it or any troubles contacting them, my information is there as well. So really take advantage of these because they're here for you. Does anyone have any questions?